morning. Uh-oh. How are you doing? All right. So I hope your night went well. I am heading out to see my second patient. So started my trip early this morning because there was one patient whose family has their mother who they're taking in for dialysis. So they wanted me to come and see the patient a little bit early today, but they ain't answering the door. So I am leaving. I'm gonna try call them later on and just turn it into a televisit because I know they need prescriptions. Hi, morning. How are you doing? So that was my first patient I just visited, but they're not there. Well, they're not answering. I think probably because it's what 8:30 now. A lot of the patients will tell you that they're sleeping. They don't have time to visit these early time of the morning, but they're a dialysis patient. And when you have dialysis, when the patients go out, they take forever to come back in. So we try to do their visits early. So I will call them later on because I'm not doing 2 trips over to see them. I'm gonna call them and just do a visit with them as a virtual visit today. All right, but my next drive is gonna be about 50 minutes to see my next patient. And I did saw that patient the other day. So most of the patients today I'm seeing, they're pretty stable. I'm not anticipating anybody needing to go to the hospital. There was one that I sent in the other day to the hospital, but it turned out that the daughter gave her fluids and she said that blood pressure and the heart rate is better. So she never needed to go to the hospital. But she said that I was in a rush to see her, even though I spent 1 hour with them. So they don't want me to come back. Don't want a different provider. I'm like, that's fine. I knew from before she was going to be one of those cases that I might have to put a question mark beside because she don't trust anybody. She don't trust the nurses at the hospital. She don't trust the doctors. She don't trust the medication. So I had to ask her if she trusts me because I will be seeing her today. And she say, yeah. I'm like, okay then, that sounds good. So I figure more or less I wouldn't last long with that family because a lot of times when the patients are like that, it's a headache for you. It's a headache. But otherwise, she said she drinks some water and the blood pressure go up and the heart rate go up. So she ain't taking her to the hospital. So I say, okay. I just respond okay because I already told them what my plan is. Because I'm not comfortable with a patient at home with a heart rate of 38 or 43 and a blood pressure of 80s over 40s. So I told them, you need to go into the hospital. But the doctor says that she just needs to drink some water. So, you only can document what you did, what your assessment findings are, your recommendations, and what the family is planning on doing. She said she don't want me to call the ambulance. She will decide later on if she wants, but I guess she never did because the next day when the office reached out to her, she said that she never bring the patient to the hospital. But she wants a new provider. So I'm like, that's fine. I'll just do my documentation and call it a day. Yeah, but apart from that patient, the other patients are fine. I don't know if they will have any provider. Well, probably from some other facility or company, but from my company, we don't have anybody servicing that area. And you have some places that are just country area, so not every provider is gonna go down there. So it might take a while before. What's your accident up on the road? So I go to my drive over this side. Uh, I hate this time of the morning, but they don't have anybody servicing on that side apart from me because they don't have much providers doing host call. So I don't know if they will get a provider soon or we will just have to discharge them from the practice. Because if they don't want the one person who's servicing that area, then there's nobody else to service the patient on that side. So a lot of times when this happens, we have to go ahead and discharge the patient and have them try to find another provider. Sometimes they will call back to say that they can't find anybody and they want the provider. So they want me to come back and see them. But honestly, when you have a bad encounter with, family members, I don't go back into that mess. I do not. I love my patients, but at the end of the day, it can burn you in the end. So I try not to, and I try not to find myself in situations like those. So if they want to go, I let them go. But when they don't have any provider to see them, I'm not a hard person. I'm not difficult. I go above and beyond some days to see my patient and still get disrespected. So when they say they want to go because they don't feel comfortable with the care that you're providing, like that's my little answer to say, you know what, let's just call it a day. Because really and truly, we don't have a lot of providers out there that is doing house calls. So for patients to be dismissing, a lot of times they don't really understand that when you dismiss the provider, the physiotherapy, all right, sometimes we have medications being delivered to them because Walmart or Walgreens or other pharmacies are very far out. So we set up all of those services. But if they don't have a provider to write the orders, there's no way they're going to get it. So when they discontinue the provider, they discontinue everything else that comes with it. So that's just for what is, so they can make their mind up, make the right decision whether or not they want to go. But if the encounter is bad, I just let them go. But how are you guys doing? Thank you so much for tuning in. All right. So if you're new here, I'm Stacy. I am a nurse. I'm originally from Jamaica, but I work as a house call nurse practitioner. So I do a lot of driving throughout the day and chit-chatting about what's going on. I remember to go ahead and subscribe to my YouTube page. I do talk a lot about nursing, travel nursing, RN, nurse practitioner, or transitioning from Jamaica to the States here. So, all right. All right, so my first patient, as I said, I did saw that patient, but well, not really see them in person. I see the host knock on the door, them not answer, so I'm not spending longer than 10 minutes waiting for a patient. Because given the fact that some of them are in wheelchair, they're bedbound, but the family members are not, so I'm not expecting them to be taking 10 whole minutes to come and open a door. So after 10 minutes, I just call it a day. So I'm heading out to see the others. So most of the time, my patients are pretty stable. Patients are pretty stable in the host call setting, unless there is something else acute going on where I need to address that. If it is something that I feel like the patient needs to go into the hospital for, I personally try to call 911. If they refuse that, then definitely I will document it. Because the last thing you want is to be accountable for someone's death when you recommend something or you didn't recommend something and the family members didn't follow through. So because a lot of the patients are on Medicare, Medicaid, I tend to do a follow-up at least twice a month, because sometimes they're not able to even follow up with their specialist. So some of them are just complicated and you just need to see them a little bit more frequently. So I tend to do that each month with those patients. So basically, the patients, like, everything that is going on. So if in the last 2 weeks or 3 weeks you haven't seen the patient, then you're just looking for any change